Hi, my name is Gibbons, and today we're going to look at testing the hip range of motion using specific tests for passive range. When we test the hip joint, what we want to look at first of all is the end range, and we have 4 end ranges. If you flex the knee, then that should be soft end feel. If I straighten the leg and do extension of the knee, then that should be a hard end feel. If I lift the leg up, then that would be a muscular end feel. And if I was to rotate, then that's more likely a capsular end feel. So that's the 4 end ranges you look for. When we're looking at the hip joint, we bring the knee to 90 degrees and the hip to 90 degrees and call it a 90-90 test. And we're going to externally rotate, and we're looking for at least a range. If that's 90 degrees, that's 0 degrees, we're looking for about 45 degrees of end range. Okay, and the feeling should be capsular, and it should be at around 45 degrees. And then the same for the internal rotation, we're looking for at least 30 to 35 degrees, and we shouldn't have any restriction, shouldn't have a hard end feel. It should be a nice feeling at about 35 degrees. We can then ask the patient to hold on to the knee, and then from this one we can slowly flex the hip as far as we can, and then we can also look for 2 things here. We can ask the patient, do they have any compression sort of pain in the anterior part of the thigh, which might indicate some acetabular tear, or it might indicate some impingement of the joint. And we're also looking at the contralateral leg if a psoas is lifting up. From that test, we're now going to cross the leg over. This is called the Faber's test, Faber by Patrick Faber. It means flexion, abduction with an external rotation. We cross the leg over the knee on the opposite leg, stabilise the contralateral hip, allow the leg to drop down, and then we're looking to see if the leg drops down. If it drops around this sort of angle, then as long as the left one is the same, then that would be okay. A lot of people will drop a lot lower, then it might indicate that you have better range of motion. In this case, it is a slight stiffness, which might indicate some issue with the hip joint. As I said, if the left one is exactly the same, then it'd be okay.